Evening, a touchy subject to begin with becomes even more controversial.
A new report by Planned Parenthood raises concerns about a stomach ulcer drug it claims some women improperly use as a drug to terminate pregnancies.
Chris Glorioso is live for us right now in the Bronx to explain why Latina women in particular are turning to this makeshift medicine instead of doctor-supervised abortions. Chris.
Well, Katie, this report concludes the use of this gastric ulcer drug for homemade abortions is well known in the heavily Latina populations here in the Bronx, in northern Manhattan, and in urban New Jersey. The FDA says the pill should not be used to terminate pregnancies, but apparently some women are using it that way, and that's why it's troubling to both pro-life and pro-choice advocates.
Many immigrants don't even know that abortion is legal in the U.S., for example, or in New York.
That is one reason a new study warns many Latina women are turning to this pill for homemade abortions. It's called Misoprostol, manufactured by Pfizer under the name Cytotec. The drug is supposed to be taken for stomach ulcers, but it has a side effect of inducing premature birth. Planned Parenthood's Heidi Morales interviewed dozens of Dominican women to see how they're turning to this pill instead of seeing doctors.
The Dominican women in the study described having their community networks, so having community contacts by which they can obtain these medications. They can also get them from their country of origin because they describe sending packages back and forth.
8 years ago, a Columbia University study of more than 600 Latinas found 15% knew someone who'd taken misoprostol for an abortion. 5% had taken it themselves. Many had little idea it could lead to infections or even the death of the mother.
And if the abortion does not occur, it can really have an impact on the fetus as well.
Another reason immigrant women tend to trust misoprostol is because it's much cheaper than physician-assisted abortion. Some Spanish websites even appear to ship the drug. That's why Silvia Henriquez of the National Latina Institute for Reproductive Health is lobbying the Obama administration to subsidize abortions with federal dollars.
Healthcare reform is a priority, and we have to ensure that we're looking at the needs of immigrant women, that we're looking at the needs of low-income women, and that abortion and reproductive health care services become part of healthcare reform.
Of course, pro-life groups like the National Conference of Catholic Bishops bitterly oppose the use of taxpayer dollars to fund abortions. And we should point out most Latina women are Catholic, and that's why this report also concludes their Catholic heritage may be one reason that they are avoiding actual abortion clinics and preferring some kind of homemade abortion, in some cases like this, using medications that are just too dangerous. Reporting live in the Bronx tonight, I'm Chris Glorioso, PIX News at 10. Back to you.
All right, Chris, thanks.